Before I turned 50, I could barely turn my head. What Top Fit Pros has done for me is to allow me to work out hard, to take care of the sore muscles, to actually work those knots out myself.
TopFitPros.com.
I'm so mad that you have bad information on the internet, especially because it's coming from reputable sites and it's about your pain. Here's the problem. You've got information that will help you to get through the night comfortably. That's true, and that's coming from those reputable sites. But what is bad about it is it's giving you information to hold yourself in a position that will reinforce the root causes of your pain. So that means that when you're up and about during the day, you're more likely to have pain. When you get out of bed in the morning, you're more likely to have pain than if you come up with solutions that are long-term in nature. We want you to have long-term solutions, things that work for you, that get you out of pain 24 hours a day, not just while you're trying to sleep. Okay? So what I recommend to you is that you watch my video, Self-Myofascial Release for Low Back Pain. The reason is I want you to understand the principles behind what we're talking about today. So what we're talking about today is how you should be sleeping at night in order to have a long-term solution to the problem. So, what is that? I'm sleeping right now the way they tell you to sleep in those videos or in those pictures, articles, whatever you get on the internet. There are a lot of them. And they have you here with a pillow between your knees and your knees curled up, your hips bent, which really is pretty comfortable unless you get uncomfortable on your hip because you're on your hip too long, then it becomes uncomfortable. But the problem is that this is keeping your hip flexors in a chronically shortened position, which is the reason you have pain in the first place, is because of chronically shortened hip flexors. We want to lengthen those hip flexors out so that you're not in pain anymore. So ideally, where you're headed towards is we want you lying flat on the bed. Flat on the bed. You could have a pillow or not, but you're flat on the bed so that your hips are straight. They're not bent here. So your hip flexors are fully lengthened out. That's where we want to get you. We're not going to get you there overnight, though. We're not going to get you there in one night. So here's another solution they give to you. You can lie with a pillow under your knees. What is that doing? Well, it's slightly bending your hips. So it's taking the pressure off of your low back. Now, for some of you, that may not be enough relief. Because if your hip flexors are tight from sitting all day like this, then even lengthening out to this point may be too much. It may be too painful. And you won't be able to get a good night's sleep. So what are you going to do? Well, you're going to put another pillow under there, right? And maybe you're going to put more than a pillow. Maybe you're going to put a blanket too. You're going to really prop it up. Now you're going, okay, now that's comfy. Now I can sleep. And that's great. This is a good starting place. This is where you want to start, is where you can get comfortable at night. But as soon as possible, I want you to start to push to the edge of that comfort. I want you to push to where you are just slightly uncomfortable, a little bit of a stretch. So you take that blanket out and you lower it just a notch. Now, it may be that you only lie in bed for 10 minutes the first night like this and go, I don't want to do this anymore. And then you put that blanket back, get comfortable, and you go to bed. What you don't want to do is stack it up higher than you need to for comfort. All right? You go right to the edge of what's comfortable and no higher with the knees. And then after that, you're going to gradually work it down. So every night, at least 5 or 10 minutes, you're going to lower it just below your comfort zone, and you're going to keep it there for a little bit, then bring it back right to the edge of the comfort zone. And eventually, you'll be able to do it with 2 pillows. You're going to go, okay, I can sleep through the night just like this. I don't need that blanket anymore. And then, gradually, you're going to get to maybe a blanket and a pillow. So you get a little lower. And then later, you get down to just the pillow. And then you get down to just the blanket. I mean, this could be 6 months. It could be any amount of time. There is not a given amount of time that this needs to be. But we want you to be working gradually in the direction of being able to sleep flat with your legs fully lengthened like this. Eventually, we get rid of that blanket. You're down like this. Your hip flexors are nice and lengthened. And you can get up during the day without pain. You can walk around. And that is, of course, if the source of the problem is these deep hip flexors. There are lots of different reasons why people have low back pain. This happens to be one of the most common, if not the most common, cause of back pain. So if you're in that category, this is really, really going to help you. And I do recommend that you see a physician to make sure there's not something else going on in your spine that really needs addressing. But if this is what it is, then this pattern of sleeping will really help you. So next time I see you, we can talk about other issues. And until then, see you then.
TopFitPros.com